Welcome to Not a Dry Eye in the House podcast by The Body Doctor. I'm Sam Wymer, Sales and Marketing Director of The Body Doctor, and I'm joined by Dr. Hilary Jones, our brand ambassador.
Hi, Sam.
Hello. So, Hilary, we all know that dry eye can affect millions of people in the UK and worldwide. I want to understand more about what can cause dry eye. Where does it start, and what are the things that we're doing in our day-to-day lives that potentially aggravate dry eye?
Plenty of things, and you're right, it's the commonest eye condition of all, affecting millions of people. People will know what we mean by dry eye syndrome if they suffer from it. Red eyes, dry, gritty, irritable eyes that have red eyelids, causing people's eyes to water, affecting their vision as well sometimes. So very common, and there's lots of things that we are exposed to that makes the condition worse. Underlying it all is the three components of the tear film that we have on the surface of our eyes to lubricate the eyes and to improve oxygenation of the surface. So there's the oily layer, the lipid layer, there's the aqueous, the watery layer, and there's the sticky mucus layer as well. And any one of those can be affected in dry eye syndrome. Now, one of the things that is increasingly common is dry eye syndrome caused by exposure to screens.
Yeah.
And the more screen time we have in our daily lives, the greater the likelihood of us developing dry eye syndrome, dry eye disease. So what we know is that we blink on average 15 to 20 times per minute, which is 1,000 times or more per hour, 7 million times per year.
Yes.
And blinking is really fundamentally important for eye health. It removes debris, including pollen in the hay fever season, from the surface of the eye. It removes that debris and the dirt. It lubricates and oxygenates the surface of the eye. So when we use screens, we blink 66% less than we do when we're not using a screen. And that's a fundamental reason why we see so many people now with dry eye syndrome.
Yeah, because I suppose screens, there is actually no escaping it, from working at an office or on your phone or a TV or iPads, whatever. There is literally a screen everywhere we go now.
That's right. And the situation is that we can mitigate the problem by doing simple things. There's something called the 20-20-20 rule, which you'll be familiar with.
Yeah.
So if you can, look away from your screen for every 20 minutes, focus on something 20 feet away, and keep focused on that for at least 20 seconds.
Yeah.
That obviously helps. We can reduce glare.
Yeah.
You can use filters on the screen.
Yeah.
We can adjust the contrast or the brightness. And of course, we can limit our exposure to screens. But children are getting plenty of dry eye syndrome now because they're using screens a lot, particularly in the evening. And therefore, they are just as subject to the problem as adults are. So those are the things we can do ourselves. But then, of course, we can help by using drops, preferably preservative-free drops, which are easy to use, and they can be used on a as necessary basis or a regular basis to make sure that dry eye syndrome doesn't occur.
So you mentioned there about children. So dry eye affecting children then is that on the rise, would you say?
Very much so. Yeah.
Wow.
To the extent that we're perhaps seeing more children with dry eye syndrome than we are in adults.
So that's must be a direct correlation with screens, because obviously
Sure.
20, 30 years ago, it wasn't like it is today.
That's right. As you know, my generation often asked the children to help us with our screens because
Yeah.
they work better than we do.
Yeah.
So drops are essential. And when I say eye drops, what these do are that they are producing an artificial tear for you. So it's not the definitive answer, but it certainly helps. And when we look at drops, what we're looking for is something that can be used regularly, but which doesn't cause any harm. And when you think that people with dry eye syndrome will often have it for years, if they don't do anything about it, you want something that works, is cost effective, and doesn't do any long-term damage. So preservative-free is definitely the way forward. That's important. You want something that's suitable for people who wear contact lenses.
Yeah.
You want something that's also useful for the three types of condition that are associated with dry eye syndrome. So dry eye syndrome itself, meibomian gland dysfunction, and blepharitis. So drops that you can rely on, use regularly, and which really help will not only prevent the problem but treat
Yeah.
it once it exists.
So how long would you? So you mentioned there as a preventative, then. So you'd think, obviously, if you reduce the glare and you change your settings and ultimately try and reduce screen time as much as possible, you think using drops as well as a preventative measure can actually help as well.
Absolutely, absolutely. So the sort of kind of drops we're talking about would include something called sodium hyaluronate. That comes in various strengths. This is a naturally occurring
Mm.
substance in the human body. It's great for acting like a sponge to retain moisture on the surface of the eye. It's also great for wound healing and tissue repair, and it is very, very useful if it's incorporated into a regular eyelid hygiene routine and using drops.
Okay, so you mentioned an eyelid hygiene. So what is? Let's explain what eyelid hygiene is. What are the we all understand dental hygiene, but not many people would understand eyelid hygiene. So do you want to just explain what that is?
Sure. Okay, so the eyelids are a physiological part of the body where you've got oil producing glands called meibomian glands. These are buried within the tissue of the eyelid, and they secrete an oil which produces the protective oily layer and prevents the evaporation of the watery
Hmm.
tear layer, if you like. So that oil is essential. But in our lives today, where we live in centrally heated offices and rooms at home, where we're exposed to wind, to cold, to dust, to pollen, these glands can easily become blocked. The oil becomes hardened. You get failure of the secretion of the oil. The watery layer of the tears dry out. You've got dry eye syndrome. So unclogging those
Mm.
glands is important, wiping away any dirt or debris, and increasing the flow of that oil is really important. So for hygiene, we recommend the three-step procedure. So first of all, heat. Use heat with a warm eye compress to unblock those glands and make sure that the oil becomes of a soft, buttery consistency, which can easily be
Mm.
expressed. And the next thing would be to cleanse the lids, to
Mm.
remove that oil that's been expressed and the debris with it. And you can use wipes, you can use lid cleansers, and you need to do this on a regular basis.
How regular? Like how often do you
I
do
would
it?
say twice a day would be really good for an excellent
Mm.
regime. So you're cleansing the lids, you're wiping away the oil that you've
Yeah, yeah.
used in step one, and any debris, anything that's blocking those glands, and then reviving. Then you revive the surface of the eye with drops. And as I say, contact lens friendly drops, preservative free. If you get a nice dispenser which gives you the right dose and gives you
Yeah,
250 doses in each
yeah,
bottle, as this one does, then you're on a winner. So that's a good hygiene
yeah.
regime for anyone, especially if they're using screens on a regular basis, and for
Okay.
kids.
And then you mentioned about preservative versus non-preservative,
Yeah,
so preservative-free
yeah.
drops in particular. What is the reasoning behind, or why is there a need for preservative-free drops? What's the benefits and things like that?
In the past, it was thought that because you are storing contact lenses
Mm.
in a storage case, because you're using you've opened the bottle, you're using the drops for several weeks or months at a time. You want to prevent contamination. You want to keep the solution sterile, so you need a preservative. The current thinking and all the research now shows that if you can avoid these preservatives, some of these preservatives used long term definitely would lead to inflammation of the surface of the eye, to some corneal inflammation, irritation, and long term damage. So benzalkonium was one that is now sort of becoming
Mm.
much less popular, and preservative free is the way forward. But that doesn't mean to say that you're compromising safety
Yeah.
and the sterility of the product. You can still have drops which are preservative free, but can be used for 6 months at a time. And if you're not using preservatives, you've got less potential if you're using them regularly every day for years and years potentially
Mm.
to cause harm.
Yeah, I think it's the market's changed. The science behind it, and also the industry. We understand now more about preservatives and the need, or let's say not the need for them. And technologies are so advanced now that you can have a drop that lasts 6 months for
Yeah,
sterility purposes without the inclusion of preservatives.
sure.
So obviously that is vital when looking for moving on to a drop either as a preventative or as an ongoing treatment. You know, dry eye. How common is it? How many people are we talking about realistically?
Oh, literally millions of people in this country alone, millions, and millions of children as well.
Why do you
So
think it's not talked about as much then?
I think people have accepted it over the years. They just say, "Oh, my eyes are a bit sore, a bit gritty. Put up with it. Bung some cream on there." But as you say, people know about dental hygiene, but very rarely do people talk about eyelid
Mm.
hygiene and eye health generally. And when you think that our eyes are exposed to the elements 24/7, we might lie awake in bed or asleep in bed with our eyes partially open. The surface of the eye is drying out. There's a lot of dust in most offices and most houses. There's a lot of indoor air pollution, which affects our eyes. And we absolutely need these organs of sense so that we can read, so that we can focus and carry on our daily activities. Why it's not talked about enough, I don't know. It's beginning to change. I know you're at the
Mm.
cutting edge
Yeah,
here at the
banging
eye
the drum.
doctor, banging
Yeah,
the drum. You're doing your research.
yeah.
Everything's scientifically, clinically proven that you use, and you're always looking forward to developing new things, and that's wonderful. But I think we're getting there slowly now. People are beginning to say, "Yeah, I'm going to look after my eyes better." Because what we don't want is people having eye problems down the line, which are more difficult to treat.
Well, yeah, they touched on a few things there. I think patient habits have changed. I think before, like you say, you had dry eye, it was seen as a inconvenience, but some instances can actually be quite debilitating.
Oh, absolutely.
We've got customers and patients who have gone years suffering, not wearing makeup, wouldn't go outside due to how windy it was, things like that. So it can lead to a huge impact on our daily lives ultimately, and confidence levels drop. So mental health is a problem, and it all links back to the cause. We you mentioned there about dust and other environmental factors. It sounds like if we just kept our eyes clean like we would our teeth clean, that can have long-lasting improvements ultimately in dry eye sufferers, but also as a preventative measure.
Absolutely. And if you think about how many millions of people use contact lenses, we know that about 50% of people who use contact lenses will suffer from some degree of dry eye syndrome,
Mm,
and one makes the other worse. So you need the lenses to be comfortable.
yeah.
And for lenses to be comfortable, you need enough moisture on the surface of the eye. You want enough oxygen to get to the surface of the eye. And sometimes adjusting which contact lens you're wearing will help that individual. And some contact lenses will suit some people more than others. However, they almost all will need to make sure that dry eye syndrome isn't occurring. If they've got it, treat it. If they haven't got it yet, they will. So use something that will
Mm.
stop that happening in the future. So I think advice about the correct kind of eye drops to use and the correct lenses to wear is absolutely vital.
Yeah, I think there's a common analogy used in the world of eye care of you don't brush your teeth only when you've got toothache. And ultimately, what we're doing now is we're treating dry eye once you've got dry eye.
Yeah.
Whereas we need to actually do it as a preventative measure. We have to take care of our eyes before they get to a stage of where you do have a dry eye disease or other similar conditions in blepharitis or meibomian gland
Mm.
dysfunction, which you mentioned. Um, you know, just on those types of conditions, blepharitis. For those who don't know what blepharitis is, would you just give us a brief overview?
Sure. Blepharitis is an inflammation of the eyelids themselves. So what you'll often see in people suffering from blepharitis is a red-rimmed eyelid that looks sore, that looks irritable. It might be causing watering of the eye. And if you look even more closely, you will see flaking. You'll see little flakes, crusting.
Yeah.
And it looks sore for the other people looking at the person who's got the condition. So that's blepharitis, and that is linked to dry eye syndrome. People with contact lenses shouldn't wear their lenses if they've got blepharitis. They should have it treated. And that means daily washing, at least twice a day, of the lids, wiping, cleansing, using that eyelid regime. And if you're using the right regime, people will be surprised how quickly it responds to that treatment without the use of antibiotics and things more powerful.
So then, do you think there's any? Obviously, we know about the importance of daily eyelid hygiene and used as a preventative and also as an ongoing treatment. Is there any other tips that you could offer us for either as preventative or even little things? Drink more water is
Yep.
such an obvious one to talk about with dry eye, but is there anything else?
Yeah, I think keeping hydrated is really important for all sorts of conditions. I think limiting screen time as much as possible. Obviously, some people's jobs depend on it,
Yeah.
but you can still adjust things so that you give your eyes a break, that you use artificial tears, something like this, that you do your daily hygiene regime on an everyday basis and not skimp at all, that you choose the right contact lenses, the right solutions for those lenses. And ask your optician if you're having problems. Also, using a hot eye compress to express the oil from the meibomian glands, because if you're protecting the aqueous part of the tear film, then you're preventing dry eye syndrome. So 85% of dry eye syndrome is evaporative; that the water is evaporating on the surface of the eye. So that's the main thing. So lubricate the surface of the eye regularly, do your hygiene, and you should be all right.
And then you said then about visiting the optician. So when should a patient go to see the optician or the GP or the pharmacist? When would be, you know, also on that basis, is the GP or the pharmacist the best person to go to, or who's the first call? Say this patient now is experiencing dry eye for the first time. They wake up in the morning, their eyes are feeling gritty. They may have a bit of blepharitis, where the lids are red or inflamed, and bit of flaking, something like that. When do they go and where do they go?
Sure, but I think everybody has this idea that the general practitioner is the generalist, knows everything about everything. In fact, they can't know everything about everything. And an optician or an ophthalmologist is much more likely to know about dry eye syndrome, be familiar with it than a GP. So I would say that would be the first port of call. If you've got any symptoms at all, go and get it sorted, and get on with your regime. Take that advice, get the products that are going to help. Obviously, if the eye specialist feels there's anything that is more concerning, if it's affecting vision in any way, if there's something else such as age-related macular degeneration, you're going to be referred to the specialist in the hospital, and that's as it should be. That's appropriate. But for most people, it will be have a look, give advice, prescribe the right treatments, and people will be grateful. And generally, for visual acuity, people should be going, on a regular basis, just like they do for a dental checkup. They should be going at least every couple of years, even if they haven't got problems.
Yeah, for sure. Okay, well, thank you for joining the first Not a Dry Eye in the House podcast. Hit like, follow, share, and we'll be back for more. Thank you.